Muted.
Exciting tools out there to really help employees understand health. We have Fred Goldstein and Tom Chamberlain with the Edlogics team on the webinar with us today. They're going to be sharing a lot of really good information for you guys. Just a couple important reminders as we get through the webinar here. Your microphones will be muted as you enter and throughout the presentation. If you have any questions, please go ahead and type those into the chat box, and we will be answering all of those at the end in our Q&A session. We'll also be sending out a follow-up email to recap everything that was discussed here today, as well as a recording of the webinar. So Fred, I'm going to go ahead and turn it over to you now.
Thank you very much, Marcelo, and thanks to We Are Wellness for putting on this webinar, and thanks actually to all of you who have hung on or are coming back into this webinar. We appreciate your patience. Just briefly, I'm the president and founder of Accountable Health, and I'm also an advisor to Edlogics. I've got a little over 30 years in healthcare, everything from hospital administration to HMO management to population health programs and employee health improvement programs. Tom Chamberlain is the founder and CEO of Edlogics. He is a PharmD with 30 years of experience designing innovative educational programs, drug information services, and patient care initiatives for healthcare organizations and the pharmaceutical industry. Edlogics is a Virginia-based organization that develops interactive educational solutions designed to improve health literacy and empower consumers to take greater responsibility for managing their health. So I'd like to get started by sort of setting the groundwork of this, and the groundwork is really about a definition of health literacy. It's a term we all hear quite frequently, but one that needs to be explained. And health literacy is the degree to which an individual has the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. So if we use this as the foundation for it, the question then becomes, what does it cost? What does poor health literacy lead to? And as the next slide demonstrates, health literacy is a major problem in the United States. It's estimated that the cost of poor health literacy is $238 billion a year. And this has to do with, if you think about it, people not making the right decisions about their health, not understanding how to take their medications, not understanding the importance of getting a screening or what the doctor told them when they leave the office. So it's really a very large problem. And you can also see when you think about this that 133 million Americans have at least one chronic condition. So we have people out there who are trying to live with these various chronic diseases and other illnesses, and they really don't understand what it is or what they need to do about that. There's also another term we'll get into a little bit later, health numeracy, the ability to understand numbers and work with numbers. And obviously when you think about healthcare, whether it's what does twice a day mean might be confusing to somebody, or a bus schedule to get to the appointment. All of those things can have an impact and are numeracy related. So let's also talk about some other issues with health literacy. We often think of this as a problem with disease or understanding condition or medication, but it's more complicated than that, particularly in the United States, and it has to get to the issue of healthcare, and insurance. And as this slide shows, at least half of U.S. adults are not familiar with basic insurance terms. So if they don't understand the insurance terms, how are they supposed to use their insurance appropriately or maximize the value of their insurance or make the right decisions about that? And even more so, we can see that only 14% of individuals in the next slide understand 4 basic terms associated with insurance, which are deductibles, co-pays, co-insurance, and maximum out-of-pocket. So what Edlogics has done is brought together, as you will see, a platform that addresses more than just an individual's health and conditions in healthcare, but goes after these other major issues. So with that, let me turn it over to Tom, and he'll begin to take you through the product and the platform.
Great. Yeah, thank you very much, Fred, and I appreciate everyone hanging in there. As Fred said, a little technical difficulties, but what I'd like to do is spend a little bit of time and also work with Fred on sharing what we're doing at Edlogics. And it's not a promotion of Edlogics as much as using what we've been doing over the last 4 years to help improve health literacy. As Fred mentioned, health literacy is a major issue. We believe it's the foundation for behavior change. Individuals need to understand their role in managing their health. We certainly need to improve health literacy to get better behavior change and educating people on why they need to do certain things. It's one thing to try to drive people into doing a biometric screen or getting their mammogram, but we feel that health literacy is critical in understanding the whys. Why should they be taking action? And as a PharmD and as a practitioner over the years, I learned firsthand in dealing in family practice and ambulatory care as I was managing my patients with chronic conditions. I could see firsthand that education was key, but it really wasn't, sticking with them because we were using back in the day print-based materials. It was not plain text. It was using complicated technical terms, and people really didn't learn well by the traditional ways of educating. So about 4.5 years ago, I figured that there would be a tremendous need as the healthcare landscape was changing, and as consumers were going to be paying for more of their healthcare, there would be increased demand for understanding more about health. So we built a company that really addressed the core area of health education by improving health literacy and making learning about health fun, engaging, and easy to understand. And what I'd like to do is just give a quick video, because I think this video really underscores what we're trying to do here at Edlogics. So I'm going to give this 90-second video to really set the stage for what we're doing at Edlogics.
Low health literacy impacts 90 million Americans and costs the U.S. economy as much as $238 billion each year. It is one of the most widespread barriers to achieving better health outcomes and is a major driver of escalating healthcare costs. Edlogics has developed a results-based, gamified multimedia approach to improving health literacy, designing web and mobile-compatible games and tools to make learning about health fun, engaging, intuitive, and effective. We help individuals manage chronic conditions like heart disease, diabetes, metabolic syndrome, and sleep apnea, learn how to take their medications, and make better healthcare decisions. Because when people better understand their health, they make better decisions. And when they make better decisions, healthcare costs go down. We don't just make learning about health fun, we verify that people are actually learning. We measure knowledge improvement and allow employers to target specific individual needs and challenges. Our innovative incentives and rewards promote employee engagement, teamwork, competition, and loyalty, leading to a healthier, more productive workforce. On average, 80% of our users have said that they will change their behavior based on what they have learned, driving down the cost of managing costly chronic conditions, or even preventing them altogether. See how Edlogics empowers individuals to manage their health, get preventive care, and make fewer health claims. A healthier workplace, more productive employees, lower healthcare costs for everyone. Learn how Edlogics can improve the health of your organization today.
So hopefully that gave a good quick overview of what we're doing at Edlogics. And what I'd like to do is spend a little bit of time on what we believe are the key attributes of our platform. And when we started building this about 4 years ago, not many people were talking about improving health literacy, but over the last 6 months or so, it's become a key part of RFPs with employers and healthcare organizations. And we figured that there's several key components that need to go into a platform if we're going to be successful in improving health literacy of our population. And it starts with evidence-based health information. Obviously, there's key teaching points on chronic conditions and common clinical conditions and insurance literacy. So we start with evidence-based health information. We work with our partners that develop and produce world-class content, both in the commercial markets, but we also work with academic medical centers like Vanderbilt University's Center for Effective Health Communications, to name one of them. So we take that evidence-based health information, and with our clinical and education team, we develop interactive health games. We believe that health games and game-based learning is a very important component of engaging consumers, making learning about health fun and interactive. So these health games have turned out to be the most prevalent way our users learn about health. And game-based learning is is something that's very simple. I'm going to show you examples of that when we do a demo of the Edlogics platform. But we integrate our interactive health games with our multimedia educational programs. So people like to learn in different ways. Some like health games, others like watching videos, others like to look and read about print-based education. But we think that our health games and our multimedia educational programs are one of the core components of our educational offerings. And then we incorporate innovative gamification strategies. And everyone's heard about gamification. It's a big buzzword. And most people now that are in the healthcare space of education and behavior change are incorporating gamification, which includes points and leaderboards and challenges and badges. And we have a health grade point average. So we have different ways that we can gamify the learning experience and incentivize people. And we'll talk a little bit more about gamification and incentives as we go through the presentation. We also believe that the personalization of the educational experience is critical. So we've been building the capabilities by working with the U.S. Preventive Services Task Force guidelines, by being able to push education that is consistent with a 55-year-old male that might be different and more personalized to that individual than a younger female. And we also allow, through our onboarding process, the ability for our users to select what areas of interest they have. They may have a family member who was recently diagnosed with cancer or pneumonia, and they want to learn more about that. We can actually allow them to select what their interests are and push that information out to them. But we're moving more into data-driven personalization, where we can take biometric information or claims data or HRA data. And if someone has on their biometrics a hemoglobin A1C of 6.0, we can automatically push information about diabetes to that individual so that we can prevent them from pre-diabetes to diabetes by educating them, engaging them to change the way that they are eating and exercising and how they're managing their health. So personalizing that learning experience is something that we continue to add to our platform. We also think we're unique in that we can validate knowledge improvement, and the ability for us to show that we're making individuals smarter or entire populations, entire employer populations smarter across the board is something that we're real excited about being able to do that. And this slide here shows how we were able to take a specific area of sleep health. We worked with Highmark Blue Cross Blue Shield, and they're very interested in sleep health education. And we published a press release on what we were able to do to increase sleep health knowledge in one of their key customers. And we took them from a baseline understanding of sleep health of 67 and moved that all the way up to a 95 on a scale of 100 on a final knowledge assessment, a 42% increase in their knowledge. And we can also look at this from an entire population perspective across the entire platform. And here you see our baseline knowledge assessments, and these are grades. On the left-hand side in the burgundy are the Fs, and in orange are the Ds. And so we got a fairly significant amount of our population on baseline that have a lot of learning to do. And there are some people that are well educated on certain areas that show up with A's, but you can see the spectrum of A through F across the board. If you look at health insurance, the seventh category down, a fair amount of people failing their baseline knowledge assessments. But after they've gone through learning modules, we've been able to show dramatic improvement in those statistics on final knowledge assessment. And you can see how we've changed the grading of that individual employer setting, and a majority of them have A's after they've gone through and done their learning. You can see health insurance, everyone got A's, and about 25% of them got B's. So we're excited about the ability to demonstrate that we can take populations and make them and demonstrate that they're improving their knowledge, but we can also do that on an individual basis. So we can help health coaches understand an individual's challenges around health literacy, and we do that through a number of ways, and we'll talk about that more, but one of those is through a health grade point average that everyone has. So we're excited about that opportunity to validate knowledge improvement, and based upon how much they're improving, how much they're interacting with the site, we've incorporated unique rewards and incentives. So based upon their activity on the site, they increase their likelihood or their odds of winning cash prizes, and we can customize those rewards and incentives for a given employer very easily, and they can be charitable contributions. They could be points that they win that are incorporated into an existing reward engine within that employer population. We can do gift cards and a number of different incentives that are really unique and customized for our clients. Fred mentioned the importance of health literacy, and I did as well, and mentioned numeracy. So in addition to health literacy, people that might be innumerate, they don't like working with numbers. There's estimated to be 110 million people in America that struggle with dealing with numbers, and in the healthcare setting, dealing with diabetes, they need to have a good appreciation, understanding of how to deal with numbers. So we like to assess health literacy and numeracy, and we do that in a number of ways during our onboarding. And one way we do that is through our ice cream challenge. This is a way for us to use both objective and subjective questions around numeracy and literacy. And in this case here, it's the ability to interpret a food label. So if someone ate the entire container of ice cream, how many calories would they eat? And you can look at 4 calories or servings per container with 250 calories that are in each serving, and you could get an answer of 1,000 to be correct. So we can assess the literacy through interactive ways of questioning these individuals. And we're not only just looking at numeracy and literacy, but we're also looking at readiness for change, self-efficacy, and health confidence. So we take all of that, and we've recently created a health literacy task force made up of some of the leading experts in the nation at Vanderbilt and University of Pittsburgh and the Medical University of South Carolina to design and build a health literacy index that can be used to help educate individuals based upon their health literacy score, and also to measure improvements in health literacy over time. So that's kind of a key component of our platform that we think is unique. All of that information is rolled up into our reporting and analytics engine. We have a separate data warehouse where we can report on virtually all of the activities that we have. We can identify gaps in knowledge and utilize that and share that with health coaches and other parts of health management programs that are being offered by an employer. We also see ourselves as a communication platform. In addition to educating individuals, we can collect information. We can do surveys and market research, as I mentioned, collecting information and reporting on that. But we can also target individual messages using our platform. And I'll show everyone an example of that when we demo the platform. Everything that we talk about today and show you on the demo is mobile responsive. So it's a beautiful user experience, whether they're on a desktop, a laptop, a smartphone, or an iPad. So any internet-connected device can share the same types of graphics and experience. And then obviously, as important as anything is the security and the scalability of our platform. So we're highly secure, HIPAA compliant. And at the end of the day, the decisions to implement the Edlogics platform really revolve around that chief security officer or that CTO, because security is critical in this day and age. So those are some of the key attributes of the Edlogics platform. And I know, Fred, that you spent a lot of time on this platform helping us build it and talk to a lot of users. I'd like to just kind of see if you have anything you'd like to add to this before I move on and show the platform.
Yeah, one thing I think they'll see it obviously is there are a lot of different ways to learn. I like to do certain things on the platform, but it's interesting when I talk to other people who are on the platform, they're using other areas to learn the same information. So some people maybe, there are certain games I really like to play. There are certain educational modules or things or hot topics, as you'll see. Other people are using different parts of it, which I really found interesting as I talked to them. And one of the other areas, Tom, you may want to touch on is this whole thing of onboarding. I've seen a lot of companies take new programs and try to figure out how to get them going, and they struggle with the launch. Can you kind of address some of that?
Sure. Before going through the platform, I'll just kind of talk a little bit about how easy it is for us to onboard. You know, being a technology company, we spend a lot of time on the user experience, but the back end of this and the ability for us to have a user experience and a product that is not going to impact HR or the wellness team. So our product is very easy to implement. It's a matter of a meeting or two that really discuss the customization requirements, what kind of rewards and incentives do they want to have, who do they want to be the person inviting their employees, whether it's the CEO or the director of their wellness program. So we put that information together very efficiently. In a matter of an hour to an hour and a half, we can get everything we need. We get the eligibility file from the employer. We whitelist it so that it's available and gets through the firewalls. And then we send out we create a campaign, an email campaign that brings everyone, increases awareness of a new product that's being made available by their employer and what the objectives are. And that may be an email that comes from the medical director. And then there's a few other emails. One of the emails that individual employees will get is this video that is part of the user experience. So 2 to 3 days before they're actually receive a registration email, they'll get this email talking about the user experience. And that's really an important part. This is a 2-minute video that individuals will click on and get a preview of what's about to be offered to them. So I'd like to go ahead and just really quickly play this quick video to show you how the user experience happens.
Maybe you just heard you have high cholesterol, or that a parent started taking high blood pressure medicine. Maybe your child was just diagnosed with diabetes. Maybe you just want to do everything you can to avoid getting sick. No matter what, Edlogics can help, both you and your family. Learn how to better manage your health, how to live a longer, healthier life, how to save money on healthcare costs, and have fun while you're at it. Play Health Scratch, a virtual scratch card game that pays you real cash or other rewards. Answer daily questions and earn bonus entries for playing games and earning extra points. Climb the leaderboard and increase your chances of winning. Play now. You could be the next big winner. Play games to test your health knowledge, compete against others, and win. Earn the title of Health Champion. Challenge a friend to a health match. Try to beat the clock. Play Drag and Drop. And keep your eyes peeled for fruits and vegetables in our scavenger hunt. Because after all, should be fun. What's hot in healthcare today? Check out our hot topics. Quiz yourself and see how much you know compared to others. Learn more about common health conditions, how to prevent them and how to treat them. Take quizzes, play games, watch videos, read articles, and more. Chances are you or someone you know takes some kind of medication. Our virtual pharmacist shows you how to take them, how they work in your body, their potential side effects, and a lot more. The internet is full of health information and advice, but not all of it is accurate or safe. Our massive library is accurate and reliable. Searching for information is easy and fast, and most importantly, trustworthy. Visit your achievements page to see your health GPA, points you've earned, activities you've completed, badges you've unlocked, and other achievements. Whether you're on a computer, tablet, or smartphone, a wealth of knowledge is right at your fingertips. You can save money, get rewarded, and improve your health with Edlogics. Start to learn and earn today.
So I'm going to go ahead and dive in a little bit more on some of those activities that were described in that brief user experience video. Let me go ahead and pull up our platform. I apologize for the interruption in the middle of that, but I'm going to go ahead and pull up our platform. And the Edlogics platform, as you can see, I had it up, I logged out. I've been logged out because I hadn't used it for 15 minutes, and that's part of our, HIPAA requirements. So I'm going to go ahead and I'm logging back in. And so I'm going to be pulling up the platform, and I'm going to go ahead and spend just a little bit of time just showing the platform and how we navigate around on this. You can see here that we have a banner that has a challenge of coronary artery disease challenge for the month of October. They get 10 extra bonus entries. We can go ahead and start that challenge. I'll show examples of that. We have this banner, can go in and show videos and can be tied into our employer's health insurance, and we have an employer scorecard. So we have the ability to do that. Down below here, we have, and when we go down below, we have the ability to tie into a telemedicine provider or push information that might be more pertinent to that individual employer. You can see here, Health Literacy Awareness Month is in the month of October, so we have information that we can customize to our given employers. Across the top up here, the Edlogics logo. Many of our customers like to keep Edlogics as a third-party education vendor, and some of them might put their own logos on there. But as we go across the point, you can see I have a 3.9 health grade point average. I've accumulated a little more than 1.5 million points since I've been on the platform. Over here, just kind of talking a little bit about how we engage spouses and family members. We think it's real important to get the entire family involved, and we think that health literacy improvement really is a family-based strategy where the spouses and even the children play an important role in that, to get maybe the dad to stop smoking or to take better care of himself. And this is how easy it is to invite a family member. So in this case, we can invite up to 5 family members. So family members are treated just like an employee. I can go here, I could type my spouse's name or my child's name in here, first name, last name, confirm their email, and select whether it was a spouse, child, and then go ahead and hit invite. And that individual will get the same invitation and the same onboarding experience as the employee did. So that's clearly a major issue for many employers that are self-insured, covering the healthcare expenditures for the entire family. We also have the ability across the top to look at a user dashboard. In this case here, here's my dashboard. It's broken down where I've got most of my points. You can see I've earned over 1 million points playing games. Our Health Scratch, our unique patent pending process for getting rewards and incentives is going to be, there's going to be a drawing that's going to take place tomorrow morning in 13 hours, 21 minutes, and 45 seconds. My odds of winning that are 155. I can go here and look at the leaderboard and go in and see how this leaderboard actually stacks up. I'm in 12th place. I have 4 daily scratch cards. I have bonus entries that I get through interacting with the site. So gamification, through points, through badges, through my grade point average, I get 15 bonus entries. I've completed the monthly challenge, and I'm getting scavenger hunt items to increase my entries into the lottery-based sweepstakes drawing, and I have a 1 in 55 chance of winning that lottery. And then you can see that this leaderboard is the #1 person in my company here, and this is the Edlogics Friends and Family company, is 1 in 24 chance of winning. And then each day I have a current ticket, so every day at 7 a.m. I get a new daily scratch card, and today's scratch card is right here, and I'll go ahead and scratch it. I can do it on my phone and take my finger and just scratch this out. And today's question is, what does not raise an infant's risk of sudden infant death syndrome? A very important area is, as parents of newborns, many people don't even know what SIDS is, but they can learn from that. So what doesn't raise it? Sleeping face down, sleeping with parents, sleeping on a soft surface or sleeping in a cool place. If I'm not really sure, I can go here and I can learn about SIDS and get the answer to that. And then once I've figured out my answer, I can go in here and correctly say sleeping in a cool room doesn't increase my risk, and I get a ticket into the Health Scratch lottery, increasing my odds of winning. And then it gives me the information around that, the answer to that question. So that's how we actually engage people on a daily basis. And if I can't do something at that moment, I can save it. So I have unscratched tickets in here that I could go in and look at these types of tickets before the lottery takes place tomorrow. I need to answer my 4 unscratched tickets. And the next drawing, as I mentioned, is going to be tomorrow. So that's how Health Scratch works. That's a daily incentive-driven program. And getting back to our daily, personal dashboard, you can see how I can see my badges, my GPA, the games that I've played. And we have various leaderboards, whether it be points earned or badges earned or games played. And we also have a recommended for you. This is where we personalize the educational experience. And based upon my preferences and saved activities, I'm going to be receiving these kinds of topics pushed out. So these are various topics. If I have a child that is prone to ear infections and I want to learn more about that, which I selected in my onboarding, I can get information on ear infections or pneumonia. I had an interest in learning about advanced directives. So I can go in and take an advanced directive quiz. And so this is how we utilize our personalization and push information out. And the way that we do that is through onboarding right now and personal preference. But as I mentioned, we're going into data-driven, so we're pushing that information out based upon biometrics and other information. So around the learning modules, we have, as Fred mentioned, we focused on chronic conditions, but we also really look at navigating the healthcare system. And I'll get to that in more detail, but you can see the topic where the money is and helping to educate those individuals. And then common conditions like migraines and upper respiratory infections or back pain, well-being, childbirth and pregnancy. We have clients that that's a major cost driver, so we added a module on pregnancy and childbirth. And then we have cancers, obviously younger populations, that are prone to cancers, where more middle-aged and older people may be more focused on chronic conditions. But we think cancer education, prevention around cancer education is critical, particularly for self-insured employers. And then we spent a lot of time advancing our education around navigating the healthcare system. So even people with high health literacy have difficulties navigating the healthcare system. So, learning about advanced directives, and as an example, going in and teaching people about what is an advanced directive and showing them videos, or being able to download the advanced directives of their state. So I can type in Virginia and download the Virginia, state advanced directives. And then I can go in here and look at videos. Why fill one out? What is an advanced directives? And the kinds of...
All right, what exactly is involved in an advanced directive? Well, each state has their own rules, and
Muted.
You might have one or more documents. And the names for all the pieces of advanced directives are...
So that's kind of the quality. It's low literacy, multimedia videos. Getting back to our learning modules, I'd like to just go ahead and show an example of, say, diabetes. A major cost driver for the entire nation and the world. But we have a format where we start with baseline knowledge assessments, and you saw some of the results of that. And then we bring them through a course, and we ask them questions about diabetes. We bring them through a multimedia course, showing them just like I showed you, and you get 10,000 points for finishing that. If I wanted to review it, even though I've already done it, I can go back and watch that video. And then I spend time learning about diabetes on the page, and I can look at, the symptoms. I can play games. I can look at, learn about drug information for medications that are used to treat diabetes. Frequently asked questions with answers. What causes diabetes with answers that are short and sweet and plain text. And then we have a multitude of videos that expand on specific aspects of diabetes, like how to inject insulin or checking your blood sugars. And then there's a number of other areas on self-care, additional information, how to talk to your doctor. Some of these are print-based and some of them
Muted.
Let me go ahead and just play, I'll show you an example of a simple game called Drag and Drop for Diabetes. And the way that this game works is kind of like in the 3rd grade, we match the column on the left with the column on the right. And so in this case here, a healthy hemoglobin A1C. I'm going to drive that. I learned that in the video that it's 5%. Diabetes caused by pregnancy, that's called gestational diabetes. The best place to store insulin, better be stored in a refrigerator. And then reasons diabetics lose feeling in their feet. I also learned that, and why I need to do daily foot checking. And those are my final answers. And I got 250 points for each one correct, and a bonus of 500 for getting all of them correct. So I got a total of 1,500 points, and I go to round 2, and then I answer these questions, and I finish the game. And when I do that, I get points and rewards, increasing my odds of winning cash prizes or other.
Muted.
So that's kind of some of the ways that we've designed our programs and played our games. I'll spend a little bit more time showing other games. We also have a comprehensive library page where we can, get information and use Health Navigator, look at, evidence-based information on checkups and wellness tools. I'm not going to spend time going over all of this, but we're excited about our medication video. All of us are at some point in our lives exposed to taking medications. Oftentimes we get a package insert, which is a complicated patient education leaflet at the pharmacy, but we've incorporated videos, and so we have the ability to share information about medications that we may have been prescribed or a parent may have been prescribed, for example, metformin, and I can go in here, I can expand this section, put an M in and look and see if metformin is in here. My mom was just prescribed metformin. I want to learn a little bit about that, and so I'll go ahead and learn about metformin so I can better help my mom manage her diabetes.
This is metformin, and you should take your dose with food. Metformin helps.
So that's kind of how we educate on medications. We think medication adherence is a critical component of reducing healthcare costs and improving outcomes. In the sake of time, since we started a little bit late, I'm going to kind of rattle through a few more features on our platform. But we have hot topics, and as you can see here, we have a variety of topics that are, help in navigating the healthcare system. A big issue is who takes care of the caregiver, and that's a big issue for employers that have employees that are caregivers that are at risk for increased cost and poor outcomes. And so this is where we'll go in and ask a question. A caretaker might not take care of themselves because they feel selfish.
Muted.
Needs first. They don't think they're doing enough, both or neither. I'll go ahead and say both. Submit that. Get the answer correct. It will tell me a little bit of information about that answer, and then it will tell me how I compared to other people in my company. So that's how the hot topics works. I'm going to get out of that, but you can see here we have a host of hundreds of topics around clinical issues and navigating the healthcare system. And our games are, as I mentioned, we have a comprehensive suite of games where we play do you want to be a health champion? We have one similar to that, just on nutrition. This is a quick game that we play called Fact or Myth. And you can see it's just a bunch of points that you can accumulate by answering quick questions. So to let lead dust blow out of old homes, you should open your windows every morning. That's probably a myth. Correct. I got 300 points. So it's topics that are clinical. Anyone can enroll in Medicare at age 62. Let's say that's a fact. That's wrong, okay? And in the sake of staying with the time, I'm just going to stop and walk away, but I got one strike. When I get 3 strikes, I finish that game. I'm going to walk away, and I'm going to kind of be able to learn and see what I did. I got some points by finishing that game. I got another entry into my lottery, and I can go in here and learn the answer to the question about enrolling. So Medicare is for people age 65 or older, not 62. So it gives us our information that we answered, and then we have games on all of these conditions, common conditions, well-being, cancers, and if we can go in here and look at navigating the healthcare system, just to show you a few different games, we have Beat the Clock for caregiving, and that's a game that's where we match and we're trying to beat the clock. I don't have time to go through this in great detail, but we match this game. A sign of healthy caregiving would be, something like not we go in here and asking for help. So often leads to caregiver burnout. That's probably going to be something like not getting the help.
Muted.
And so I'll go through this and try to beat the clock. I get points. So I'm going to stop there on our games, and we're coming up on, on the hour and 10 minutes, but we have a number of achievements that we have in here. So badges, company scorecards, scavenger hunt, and then we have, full analytics capabilities, what we're able to share with our clients so that we can identify gaps in knowledge, share some of that information with the appropriate opt-ins and the necessary security controls and HIPAA compliance. So that's kind of a quick overview of our site. We've shown you about 7% of the site. One thing I mentioned earlier, you can see up at the top here, don't forget to register for your biometric screening. You can complete your screenings between October 1st and November 1st, and where to sign up or call. So we can put information and messages like that that are customized for a given employer, and they can appear on a given day and go away. And we can have up to 4 of those messages showing up at any given time. So Fred, I'm going to kind of stop there for a second. I'm going to
Muted.
If you would have any comments that I quickly ran through, and again, we are running short on time because we started a little late, but would you like to comment further on the platform?
Yeah, I just think obviously that's a really fast run through for everybody. But what's different about Edlogics that I've seen, and I've seen a lot of different programs out there, wellness programs, educational platforms, et cetera, is one, the building it upon the science of health literacy, which is so critical, and two, setting up a site that's engaging enough, but it's not, people hear about games, they think, oh my gosh, it's going to be shoot 'em up this or do that, and we really looked at the studies and said, here are the types of games that actually provide education on the back end. And just an important point to consider, when we did a webinar with the CDC almost about a year ago now, one of the comments the CDC Health Literacy Director said is, we've known for 30 years that handing out pamphlets doesn't do any good, yet we still do it. And I think it really is time to recognize there are proven methods and ways to do education that sticks with people and helps them to better manage their health. And that's what this platform is about. So, as you look at things, really consider, what's it built on? What's it based on? Is there science behind what's being done with it? And that's one of the reasons I've been with Edlogics for a while. I mean, as I said, I've seen most of the major platforms out there through my career. So thanks, Tom.
Yeah, no problem. And just a few comments. As we get into more shared decision making, obviously health literacy improvement is a requirement. It's really an imperative so that we can better interact with our individual patients if they shift into the provider side of the marketplace. So everyone wins by improving health literacy. And we oftentimes, we're now getting requests to build campaigns around opioids. So I didn't have time to show you, but we have an addiction module, and we're building an opioid module as well. So we can do a campaign with specific areas of metabolic syndrome or medication adherence or opioids, and build educational campaigns using the platform as a resource for individuals to reinforce learning and also share that kind of learning with a family member or a friend that may be struggling from an addiction issue. So we think that the ability to take this enduring material that's evidence-based and fun and engaging and share that and build it into various campaigns. This is a very common example of testimonials that we receive on a regular basis. This is a Town Bank employee that sent us this, and you can see how her love of this platform is pretty evident. The topic of the month, the quizzes, the daily questions, the games, the ability to check on the medical conditions and get answers to her questions about the health of her or her family members. And then again, thanking Town for making this site available to her. But this is very common and typical of what we get from many of our clients. And the engagement that we're getting, the email click-through rates are well above the industry standards. Where our last company that we enrolled, a company in Cincinnati, where in 5 weeks we had close to 84% of the employees registered, engaged, and are using this site on a regular basis. So we have very high engagement rates. We're showing that we're improving health literacy, and over time we're going to be able to look at how are we impacting refill rates or various types of outcomes, including claims and resource utilization. We have a game we're building called This or That, and that's around, you know, ER versus urgent care. So giving scenarios, and there's two choices, whether it's choosing a physician or emergency room versus urgent care, or eating or caregiving. So we have different areas that we're building games and launching new features and functionality on a regular basis. This testimonial here is probably more pertinent to the people on this call today, whether you're in a wellness role or if you're an HR person. The impact on the HR department is critical. Everyone's busy. They're going through open enrollment. But in this middle paragraph here, the second paragraph, Christy Rudisil from Town Bank really talks about how effortless it was to implement the Edlogics platform. We did all the work for them, and we handle the rewards, we do the onboarding, we handle the entire scope of work for this. All they do is really need to do is tell us how they want this to be rolled out, what are some of the customization requirements. But that's what we pride ourselves on, is making it easy for our customers. And again, we can onboard this during the benefit enrollment period, but most of our clients like to onboard off enrollment. It can be any month of the year, and we can engage those individuals. And what we think that we're most valuable is educating people, but also driving them to increase participation in their telemedicine programs or in their other disease management programs and wellness. So we integrate. We have a number of companies that we integrate with, and we serve as the front end, the funnel, to educate consumers so that they know enough of why they should enroll into a cardiovascular risk reduction program. It's not enough just to try to motivate them to take their biometrics or to enroll into a program. We believe that, you know, we need to empower them by educating them so they understand the whys and what happens if they don't start taking control of their health. So those are some of the testimonials that we get, and I'm going to kind of wrap up there as we're coming up on the hour. I wish we had more time, but we do want to ask everyone, if they have questions, to submit it into their chat box if you haven't already done so. And I think, Marcelo, you've probably got some questions for us in the last few minutes that we have.
Yes, thank you very much, Tom. We did have a couple questions come in. So the first one, where do the incentives come from? Are those decided on by the employer, or does that come from Edlogics?
So the incentive, we work with our employers to recommend what the incentive might be, what works well in our engagement. You know, we think that every 2 weeks is better than every month, but if they want to go monthly, if they want 5 winners every month versus 2 winners every 2 weeks, it really is customized to their needs. And then we build that into the pricing. So we handle and cut the checks, or we drive the points, or in the case of one of our clients, they have their own internal gift cards. So they win gift cards, 3 winners every 2 weeks. So it's designed to be an interactive decision, collaborating with Edlogics and our clients. And we typically set goals also. So there's a corporate goal. I didn't have time to show that, but we may have 1.7 million points for the quarter and a health GPA goal of 3.5. And if they achieve those goals, there can be additional incentives.
Okay, great. Thank you. And do you work with health plans, with the health plans?
Yes, we're working with health plans. We have several health plans that are using us to a certain degree as a value-add service, making it available to their clients, subsidizing part of the platform. It's in everyone's best interest, the health plans, the employer, the individual, to have better decision-making, empowering them to get more engaged in their care, to improve health outcomes and reduce healthcare costs. So we work with health plans in a number of ways, and we have the ability, and we're building new features and functionality to interact with health coaching, making this individual information available to a health coach with opt-in. And with one employer that uses clinics, we have prescribed education. So as an individual goes for their diabetes care in a clinic, that physician can check off that they want them to learn about diabetes and vaccinations and weight management. And so it's a prescribed education sheet that they use to direct them. And the next time they come in, they can share and see the results of that education and hopefully improvements in their understanding of that disease state.
Great. And is the company built for all the employees or only those who use the platform?
The way that we work is we do it as a PEPM. We like to really look at it, and our pricing is extremely affordable. We actually charge, and it's for less than $20 per family per year, and depending upon the size, that goes down. But that could be in the range of $14 to $20 per family per year. We like to look at it that way, and so we charge it on an individual employee basis, but we invite their entire family unit and invite them in. So that's our pricing range.
Muted.
On the high end of, for the most part, depending on the size, it's going to be $20 per family per year. And we are building out new content for younger adults. We're actually even talking with universities, making this available to various students on large college campuses, because we think health literacy needs to start at a younger age. And a lot of universities are trying to educate their student population to be healthier and make better decisions.
All right, thank you. And how would someone go about getting a quote for this?
They would, in this case, we're working closely with We Are Wellness. So on the screen here, we have Billy Barrios. Many of you are working with We Are Wellness, but that contact information, we work as a partner to We Are Wellness. They're out there pushing this capability and really trying to drive the importance of improving health literacy, so that all of the other programs and services that you're working on and offering to your clients works better, has better participation and engagement. So that's what we would recommend is going directly to your organization. And Fred, you may want to add to any of those questions and expand on anything I said.
And thanks, Tom. I think you did a good job with all of them, so nothing to add there.
We did have a couple more come in as you were speaking. Is there a concern that employees will do too much of this during work hours to get the rewards?
Yeah, we've had that come up by some organizations, and once we looked at the data, the majority of the activity is after hours. We had some people at lunchtime. There are some people that might get on for 3 or 4 minutes, play a couple games, and those employers that are really, trying to really engage their population and build a culture around health are supportive of people walking and doing good things to improve their health and wellness. So we haven't, we've had a few questions about it, but we've never had anyone really be concerned too much. So about 70% of our activity is in the weekends and the evenings, with some of it going on during the day. But again, it's not really a platform that they're going to spend an hour on. Oftentimes they're on there. Our average session time is a little over 10 minutes. We have about 3.6 average logins per month. And, so people are using it at times during work hours, during breaks, during lunch. But again, they're being educated and they're not spending lots of time on that.
Okay. And what % of the employees from the employer do you need?
What % of the,
I guess, pricing?
So if it's if it's a 5,000 or 2,000 employees, we would charge that on a 2,000 employees. So some, and we would shoot to get 50, 60, 70% engagement. So it really depends upon, you know, how the organization helps us drive awareness and marketing of that. We have posters, we have tent cards, we have really innovative educational programs. We just built a functionality to invite a coworker. So we incentivize individuals that are using the platform to invite 5 workers that are not by submitting their email. And in this particular case, we had a $500 drawing that took place, or that is taking place actually in another couple of weeks. So we have unique ways that we can drive engagement within that employer, but there's no set amount other than we're trying to get the highest engagement possible and building creative ways to market this and incentivize people to be engaged.
Great. So they're asking, they have about 100 employees. Do you guys go to those types of numbers?
So we do have smaller organizations, and in that case, it's not a PEPM or a per year, per family, like I said. It's more of a licensing fee. So because they are smaller, they're not going to be paying a lot of money, but it's going to be on a per head basis. It's going to be more. But those employers that are really trying to build a culture of health and help their employees better manage their healthcare costs, see that as a valuable service, and we would work with them on a licensing fee basis. But again, it's very affordable, particularly when you look at the amount that is going into the healthcare needs of that individual from insurance and medications and everything else. So we will work with them, but we price it differently.
Okay, perfect. Thank you very much for answering all of those questions.
But I know that we're a little bit over. Are we beginning to wrap up and being respectful of everyone's time, Marcelo?
Yes, definitely. Those are all the questions that came in. So just a quick reminder to everybody, everyone will be receiving a follow-up from us, We Are Wellness. That's going to include the PowerPoint slides as well as the recording. And I'd like to thank Fred and Tom for both doing such a great job presenting today.
Great. Well, we want to thank We Are Wellness, and Fred, thank you very much for serving as the moderator. Again, we had some technical difficulties that really put us behind, didn't give us a chance to show as much as we wanted, but we're more than willing to deliver a more personalized presentation if someone's more interested in learning more about the platform. So again, thank you very much, and I'll turn it back over to Fred.
Tom, real quick, sorry. We had one more question come in. How will we receive CE certificates?
That is something that we actually are doing. I don't know if We Are Wellness, I don't think you went after CE certificates, but we are working when we do our programs ourselves. This is on behalf of We Are Wellness, but we are going to be offering CE credits on programs that we roll out. But this one here specifically has not been, I don't believe, Marcelo, you guys have applied for that.
No, that's correct.
And we apologize for that, but that's a great question and something that we're doing in all of our educational programs.
All right, those are all of the questions. So once again, thank you everybody for joining, and we hope everyone has a great day.
Great, thanks everyone, and again, have a great day, and look forward to hearing from some of you. Thank you again, Fred. Thank you, Marcelo.
Thank you. Bye.